Hello, doctor.
Hello to you too.
How common is infection among patients who receive lens implantation surgery worldwide?
Actually, it's not easy to calculate exact statistics for that. Infections are actually very rare. Cataract surgery is one of the most common procedures in ophthalmology. With cataract surgery, the risk of developing endophthalmitis, an infection inside the eye, is about 1 in 2,000 to 3,000 cases. Cataract surgery is a more invasive procedure. It involves removing the natural lens and inserting an artificial lens, so the surgery takes longer and causes slightly more trauma to the eye. In contrast, lens implantation surgery, such as ICL surgery, is completed by making a small incision and inserting the lens, which results in much less trauma. It is still an intraocular surgery, but it is less invasive overall. The general agreement is that the infection rate is about 1/10 that of cataract surgery, and based on academic data, the risk is estimated to be around 1 in 20,000 to 30,000 cases. And speaking from my own experience, I have been performing this surgery continuously for 23 years since it was first introduced in Korea in 2002. Among all the patients I have operated on, I have not encountered a single case that I would classify as a definite, severe intraocular infection. That's been very fortunate. Of course, this is also because the surgeries are performed carefully. We strictly follow sterilization protocols, ensure proper use of eye drops, and provide thorough patient care. So overall, both from what I have observed and from my own surgical experience, cases that could truly be considered infections have been extremely rare, and thinking of the risk as roughly 1 in several tens of thousands does not seem far off. Because I previously worked at a university hospital, I did see a number of cases where patients developed severe inflammation after surgery elsewhere and were referred to us. So thinking that inflammation can never occur would be a misunderstanding. It is clearly a possible complication, which is why surgery, sterilization, post-operative care, and proper use of eye drops must be carried out very thoroughly. That said, it is not something that occurs frequently enough to be overly feared. That is definitely true.
In lens implantation surgery, the lens goes inside the eye.
Correct.
Could an infection occur because of that lens?
Contact lenses, that is, the ICL lenses that go inside the eye, are inserted into the eye in a completely sterile, uncontaminated state. But then why does an infection occur? It's not because the lens itself has bacteria on it. During surgery, we use fully sterilized instruments. The issue is that our eyes naturally have bacteria called resident bacteria, especially around the eyelids. Among them, golden staph, a type of staph bacteria, is the most common. Besides that, for example, if someone has had a stye or another type of conjunctivitis, there could be a slightly higher chance of secondary infections, so there might be more bacteria present. So those bacteria are already present, and no matter how thoroughly we sterilize, they cannot be completely eliminated. During surgery, we make an incision in the eye and insert the lens through it, so it is possible that some bacteria from the instruments could enter. That is what we believe. That is why we use antibiotic eye drops diligently after the surgery. But then why does an infection occur in some people and not in others? People who have a higher amount of these bacteria combined with their own natural immune system determine how likely an infection is. For example, someone who is taking immunosuppressants or using steroids may have a weaker immune system, which makes them more vulnerable. In these situations, we are especially careful and take extra precautions. So, if there are no underlying risk factors and the surgery is performed safely and cleanly, the likelihood of developing such an inflammatory reaction is actually very low, and there are few causes for it. After surgery, we tell patients not to wash their face or touch their eyes with their hands. This is because it takes time for the incision to heal. If someone washes their face while the wound is still slightly open, even tap water could contain bacteria that might enter. There can also be bacteria on the hands, and these could enter the eye and cause an infection. That is why we repeatedly emphasize the importance of careful care during the first 24 to 48 hours while the wound is naturally sealing itself, to prevent any inflammation from developing.
Some asked whether it is okay for tap water to get into the eye.
When after the surgery?
After 3 days.
Yes, after that is fine. As I mentioned earlier, the reason tap water is not allowed is because it is harmful to the eye itself. It is because contaminated elements in the tap water, such as bacteria or harmful substances, could enter the eye. But usually after about 24 hours, the small incision of around 2 to 3 millimeters where we inserted the lens has mostly healed. But if you press hard, it could slightly open. That is why I tell patients not to wash their face for up to 48 hours. Even if you are careful, you might accidentally press on your eye while washing. To eliminate all those risks, after about 48 hours, the wound is secure enough that normal pressure won't open it. So, you can wash your face but still avoid pressing on the eye. When someone asks me what's important for taking care of your eyes, I always make it a point to explain three main things. First, do not rub your eyes. Second, protect them from too much ultraviolet exposure by wearing sunglasses or other protective eyewear. Sunscreen is not enough. Wear sunglasses or goggles if you are out for a while. And third, do not leave your eyes dry. These 3 points are basic eye care tips everyone should follow, whether you have had surgery or not. Remember them well.